Back with part two of my big fat American healthcare system. We have rectified our technical difficulties, and we are back. So, Jordan, you were just about to talk a little bit about the origins of the BMI and slavery.
Yes. So just again, really quickly, the BMI, the standard of BMI gets its grounding, its beginnings in slavery and sort of categorizing black bodies to sell. And so that's its origins. It has its regrain through the eugenics movement, right? So it's getting back through. It has some really ugly histories around sort
Mhm.
of things. But the one thing it doesn't do is actually measure people's health. And I think that
Mhm.
that's the important thing is that every study shows that it's actually a really poor it's a really poor study of people's health. There are lots of people who have low BMIs who aren't so-called fit. They can't,
Yeah.
they're not active, they're not doing things. And there are plenty of large bodies who are fit, who do have other health outcomes. And so, it's not a good, there's no study that says BMI is going to tell you how long you're going to live or how healthy you are, right? It
Mhm.
just, and so it's grounding in it's not just a bad history, like it isn't just a bad history, it's also a really bad gauge of health, as
Mhm.
again every scientific study shows. So the question then is like, why do they get so put into why are they so close to each other? And for me the question again is money. It's about the ability to make money off of people at some point realized, early some of the early diet fads are actually in the 1880s, 1890s, right? New York Times is putting them on the front
Mhm.
page. They're talking about it. I think Atkins first, the diet around it first comes around in the early 1900s. It gets rebirthed, repackaged, re-put in. And these things have been around for a while, but they always have the same story, which is telling you that you're unhealthy for your size and it's your fault, is a
Mhm.
way to make money and a way to bifurcate people, a way to divide people, and a way to tell people some people are worthy and some people aren't. And every time you can
Mhm.
do that, you make money, you get power, you have the ability to hold on to things. There's a lot of benefit to people in power and people with money to telling people that they're not worthy and you should judge those people.
Yeah. And yeah, no, exactly. And it's not just like the wild diet industry, right? That's part of the issue here, right? This has been built into medical school curriculums. A lot of these
Yeah.
misconceptions have been built into the kind of nutritional advice that we get from the time that we're children. And it's really just become completely ingrained in our medical system. So it's not just like, the fad diets that are making money off of this. It's your doctor who performs the bariatric surgery, right? It's the company that sells the pill they're going to give you to try and make you smaller.
Yeah, I went to a new doctor and she told me to lose some weight. And she said, and then I said, okay, like whatever. And then she said, um, why don't you go to the nutritionist? And I was like, oh, this will be fun. I was like, yes, sign me up. I have time to
Let
go
me
to this
wait,
person.
hold on a second. Let me just interject and say, if you look at Jordan's meals on Instagram, you would know that this man is eating healthy. There's
Yes,
some
yes,
quinoa up there. There's some
yes,
other shit. But anyway, so you
yeah,
go to this
yes. So
nutritionist.
we're mostly vegan, and I drink water and coffee with no additives. Like I am boring. And so I was like, this will be interesting, this will be fun. So I went to the thing, and the nutritionist, the doctor prescribed nutritionist, the only thing that they were prescribing as a fix for this thing was bariatric surgery, and the most expensive kind that would make them the most money
Mm,
immediately, right? Like I
mm,
didn't go from like, you should lose some weight, why don't you try exercise, or we have a program, like nothing like that, right? Like nothing. It was immediate. It wasn't like, let's find out what you're eating and maybe you could do a little bit better. It was like surgery. Like that was the first meeting of the that I got when I got my not prescription's not the word, when I got the referral from my doctor to the nutritionist. It was bariatric surgery, right?
Step
Immediately
one,
the most
cut
expensive.
you open. Like,
Right.
come on. You're a
And that's
nutritionist, god damn it.
but it
Don't
was
you
a group
believe
of
in it?
and it was a group of people. It was a group of people, and they're all fat people, and we were on a Zoom, and so I started messaging people because I was only there for the shits and giggles. I wasn't there to take it seriously, and
Mhm.
And I wanted to talk to the people who were there because they are literally telling us in this meeting to drink less soda, to think about what we're putting in our bodies. And I'm like, there is not a fat person I've ever met who isn't obsessed with what it looks like, what we're eating. Like it's just constantly told to us that we can't eat in front of other people because there's judgments. And so I started messaging people like, have you ever been told not to drink soda? And like the person's laughing, and I'm like, I'm sorry you're dealing with this, and have other concerns. And I'm just in the messages, like private messaging people on the thing, saying like, hey, is this infuriating you like it's infuriating me? And everybody was like, yeah, this is ridiculous. Some people were there for the surgery, but they were like, I wish this was helpful. I wish this answered my questions about it. I have real concerns, right? My doctors, I'm sure, telling them to do it. So these people came because they are fat people looking for answers for their medical problems, and they're getting told like, don't drink soda and exercise more, as if again it's the first time anybody had ever said these things to them, and not anything particular about their concerns, their real lived experiences as being fat people. And I don't want to judge their decisions. Bariatric surgery may be the right decision for those people, but no one said to me, I'm glad I'm here. I'm learning a lot, and I'm ready for surgery. Everybody was like, I have real questions, and this is bullshit. Right?
I mean, yeah, the surgery has become a very popular product that is marketed to us consistently. There's a woman named Lisa Erlinger, and she is a family physician and a professor and in Washington, and she does a really good job of kind of articulating some of these things. But she pointed out that, as this is a quote from her, as a medical community, we've accepted much poorer evidence for weight loss surgery and weight loss drugs than we would for anything else. The reason we accept that is partly because we have been slowly conditioned to accept more and more outrageous, quote unquote, science from this industry, and because we're predisposed to believe it because of the diet culture we live in. So we see that constant cycle of, that kind of constant like reinforcement of this idea over and over again. And the bariatric surgery is such a good example of that, because there are some tremendously negative outcomes that are very common with that surgery. And yet, you're being funneled into a fucking, it's almost like trying to sell you a timeshare or whatever.
You went into a
nutritionist.
Again, right? Like it's not, I want to be careful and say that people have medical concerns, medical needs, and that surgery may be right for them. But I was not there for that. I was told I was going to a nutritionist because I needed to lose 10 pounds, right? And next thing you know, they're funneling me into this bariatric surgery. And that's wild. That's a wild thing to say to somebody, lose 10 pounds, major surgery that could kill you.
Yeah.
Right?
Yeah, no, it's totally true. And you think about like other areas where people like desperately want or need surgery, right? Trans folks who need gender affirming care, women who need hysterectomies and stuff like that. And women who need abortions, right? In order to access any of those things, you have to basically see 7 psychiatrists who will confirm that you're not crazy first before you can actually, because we say surgery is a very serious thing, right?
Right.
Unless you're fat, in which case you should just watch a commercial on TV and sign up for surgery, because there's nothing worse than being fat.
Yep. And so I want to quote one of the articles that you found that I just absolutely love. It's Dr. Dory Steinberg. It's from an article where, quote, I designed programs to help people lose weight. Everything that I thought I knew was wrong. And one of the quotes from it that I just absolutely love: after many attempts to design an effective weight loss program, I realized that the data from studies I worked on never succeeded in showing that weight could be modified long term. And it wasn't just in my own research. The broader scientific literature showed similar results. In one prominent national study, only 10 to 20% of study participants maintained weight loss after 1 year, even lower rates years later. And just to be clear, that means that that's where you get about only 3% succeeded long-term in the weight loss. The healthcare, she goes on to say the healthcare industry has put too large an emphasis on the relationship between weight and health. rather than investigating other factors for conditions like chronic pain and diabetes. And many clinicians will almost instinctively turn first to weight loss and suggest that weight loss is the answer. This type of weight bias has increased over the past decade. So I just think it's important because that is a person whose job it was to be a nutritionist for, she was a national person saying that what we're telling you is happening is like what she did, right? She's telling you this is what we did, and it's not real. It's a fantasy, and
Yeah,
it's a
yeah.
painful fantasy for for fat people who buy into it, who leave it,
Mm.
who can't love themselves the way they are, and it's dangerous because again, we're not getting the care we need when we need it for the things that are going on in our bodies.
Yeah,
And we're
yeah.
not trusted. We're not trusted when we say things are problems. We're not trusted to be advocates on our behalf, to say that I can feel what's happening in my body, right?
Mhm,
And
mhm, mhm.
and believed, and you treat it. They're just like, oh, it was just fat.
No,
Imagine
no,
that.
it's totally, and obviously, again, this is connected back to issues of, issues of race and also of class, right? If you go to the CDC's page about their info on quote unquote obesity, they will tell you that the obesity prevalence was, and I'm putting all this in quotes, 41.9% by March 2020, right? So that means that nearly half the people in this country have this quote unquote disease called obesity, right? And when they break down their statistics further, they break them down by race and education, right? So, sorry, Jordan, non-Hispanic Black adults have the highest age-adjusted prevalence of obesity, followed by Hispanic adults and non-Hispanic white adults, right? And then finally, men and women with college degrees had lower obesity prevalence compared to those with less education. Now, there are no accidents there, right?
No.
The reason that fat people, they feel like we're easy to ignore is because a lot of us are Black or brown or haven't had education, and what is lack of
Yep.
education in this country except a code for poor, right?
Yep.
Yeah.
Yeah, and they intersect perfectly for a reason, right? It's not an accident that the sort of birth of these things comes from slavery, comes from a lack of, hatred, and they're always peddled to people who are struggling, who are looking for who are trying to find hope and futures. And so yeah, there's a sort of, there's always, not to mention the sort of, without getting into like food deserts and lack of healthy foods, or the way in which they peddled sugar for years. Like there's all these things that are going on. The fact that, I think, the other pieces we could talk about endlessly are how much people work, right? And like how much work puts stresses on our bodies. That
Mm.
never gets talked about. No one ever says, no one ever says you should work less. Like part of I always joke, like, you want to know why the Rockefellers are skinny? They don't have to do anything. They don't like they can, they're not working
Yeah.
hard for a living. There's a reason that there's a corollary between enslaved persons and and size. Besides the like modern, besides the like large eugenics movement to make sure I could carry heavy things for white people for free,
Mm.
and my ancestors of that. Besides that, there's like, there's trauma, there's pieces, there's food that were available to us, right? There's all of these pieces are intermixing, and
Yeah.
there's never like, we should look into providing people healthier, less stressful lives, making sure that they have roofs over their head and healthy food available to them. It's your fault.
Yeah.
You're
Yeah.
the responsible for this problem, and
Yeah.
it mirrors the other things, the other ills in our society, which is to blame the people rather than to dig deeper into what is going on with
Mm,
people,
mhm,
and how
mhm.
are we failing them, how are we not supporting them, how are we not seeing people again, um, for their whole complexities, right? It's
Yeah.
just
Yeah.
you're at fault. um
Yeah.
it-
That cut.
it's
That cut. Oh, sorry. Go on.
You go ahead.
I was just going to say that that gets us into a kind of larger question. One of the reasons that I got most really interested in this in my work at healthcare now is because so frequently, one of the things that I hear from opponents of healthcare justice and opponents of Medicare for all is that the reason that the U.S. that other countries can have a Medicare for all type system, right, and the U.S. can't, is because we're all too damn fat. And I mean, that's something we hear over and over again, right? People in the US are impossible to insure, impossible to provide healthcare for because we're so fat, and obviously it's our fault. And so that is, we've sort of become the boogeyman of American healthcare policy. And I'm really interested in just like, yeah, I mean, how that happened and when did we become the burden on society?
I mean, the funny thing about that, just really quick, is that the happiest place on earth, Denmark, about half of all of its population is obese, and it has
Hmm.
free just about everything.
Yep. Yep.
It's just not
Yep.
factually true, just to be clear, just for people who are saying something like that. But I have also heard that, and I think it's important to note that, like, what we're asked. I think what science is telling us is clear is we need to treat um, fat people like we treat. Well, I don't want to treat fat people like we treat black people, but in theory, we should treat fat people like with the understanding that there's a weight neutral. That like your weight may be an indication of something, but it's likely not. It's likely just that you live, and we need to be treated with the things that we're going to the doctor, because in America, no one's going to the doctor unless something has gone wrong, because none of us can afford it.
Oh,
And
yeah.
so if people are going to, what we're asking for is to hear what we're saying, treat those things, and go through the process of the weight neutral healthcare. I think you could talk, I think, a little bit better to it than I can, but I just think that's ultimately what we're asking for.
Yeah, no, I think that that's absolutely right. And I think that like, one one thing to to consider here that's really important that I know you have some really strong feelings about, and it'll surprise you, but I am also very much in favor of this, is that Medicare for all would actually be an awesome way. And that's why the podcast is called Medicare for All. No, Medicare for all would be an awesome way of actually starting towards a world, right, where we actually had this kind of weight neutral healthcare.
Yeah, because most people don't think about it this way, but there's very few sort of universal standards. It's a lot of a lot of the standards, a lot of the ways in which doctors are trained or doctors get updated once they're already doctors. It's actually through the for-profit system.
Hmm.
It's the hospitals, it's the insurance pushing updates, pushing new ideas, right? It's through the for-profit eye that they are constantly being updated and told, and being and how they can treat us, the fact that they get less time with us. Those are all insurance
Hmm.
mandated cyst problems. These are all problems created by, right, like, part of the reason my doctor doesn't have time to find out what I eat is that the insurance won't pay for that time, right? And
Hmm.
so all
Hmm.
parts of the failure are about the fact that we have a for-profit system. The reason that when I walk into a doctor's office, they see money before a person is because of our for-profit system. They're not seeing Jordan. They're seeing a
Hmm.
person who statistically is likely to cost them money because maybe I don't have health insurance or I don't have good health insurance. They're seeing a person who's deaf, who's like, regardless of anything I tell them, who's going to have worse outcomes, who eats poorly, who doesn't do anything, and so I'm going to cost them money, right? And the insurance going to cost, and so they're making cost effective. They're making cost decisions when I walk into a room, when I walk into a place, about how to treat me. They're not treating me like I could pay for anything that they offer. They're not treating me like I have the support systems or resources to manage whatever care I need. They're treating me like a widget that they need to
Hmm.
assess my ability to pay them money for the care that I need. And that's
Yep.
true of every single person in the system. When women walk in, they're treating it the same way. They're treating you like you get 70 cents on every dollar. That's how, and and they're going to treat you. They're and your healthcare decisions are yours up until like men are involved, and regardless of your personal situation or personal preferences, right? Like it's just immediately in a pitch. Right, immediately patriarchal, right? All of these systems, but it's about money. It's about who can sue them, who can pay for it, who can pay for their care. All of those things are things. And so healthcare for all fixes a lot of these problems. It's not going to fix everything. America has racism to its core. It's embedded in our institutions. It will be embedded in Medicare for all. If when we get it, we will still have to battle racism. But it does a lot to fight these problems, because if my doctor can start to see me as a person, all of a sudden, all of these isms, all these things start to fall away, and they have the time to know me. I'm going to go to the doctor more because I know that I don't have to worry about, can I afford it? I'm going to go because I need it, because something's happened, or maybe because I want to prevent something. For God, crazy. Maybe I want to prevent. Shocking. Sorry, trying to get that word out. Crazy, but it's bonkers, right? Like, I want to get them preventive. So Medicare for all fixes a lot of the ways in which we're forced to interact with the system, and it can force science back into how we get treated in the medical profession, because science is detached from current health, from the way that doctors are trained. They're trained. They're not like, there's not, the reason that every doctor talks to us this way isn't because they're all individually bad people, right? They get trained. We all get, I have had Black doctors. I've had young doctors, old doctors. I've had women. I've had men. I've had different nationalities. The reason they all do the same thing is that is the training. They are trained when you walk in the door and they see your weight to say, have you thought about, right? Like, have you thought about losing weight? They're not making that up on the fly. They're trained. They're told that's what you got to say to that person.
I mean, if one doctor says that to you, you're like, that's an anomaly. Right. But if literally every doctor you ever see for your entire life says that to you, you're like, they're learning this somewhere. Is it the parents? Are the parents to blame? Maybe
it is the parents. It's our institutional parents. We need to, and so really what we're saying is science needs to go back into the way in which we treat fat people, the same way that we needed science to say clearly that Black people aren't inferior, because there was a time science believed differently. And, and there was we need science to take seriously that women's reproductive healthcare and women's healthcare generally is different than men's. And you need to actually study women so that we can treat women. And then we need to figure out how we're intersecting the more interesting things with people who don't fit neatly into sort of modern gender understanding, right? Not modern, past, no longer modern gender understandings. And we need to do a better job of studying that, understanding that. And but that's made possible if we have one system paying people, and then people can then go to their doctor and get that individualized care. Because that's really what we're saying is, don't treat a Black person, a Black man, treat Jordan. What is Jordan's healthcare needs? And that's really the thing we're asking for. And Medicare for all can get there. Yes. Yeah. I have the time to ask some questions. Yeah.
No, I think that's such a great point. And I want to underline that, because so many conversations about fat phobia and fat shaming in our society, basically just evolve into let's be nicer to fat people. Let's all learn to love ourselves. Fuck you. We love ourselves enough. Now let's create a healthcare system that loves us too.
Yes, exactly. Amen. All
right. That is awesome. Listen, I think that we're over time, so I'm definitely going to wrap up now. But I want to thank you so much for being here, Jordan. This has been such a good conversation, and
thank you.
So great on not just this, but every issue. So I love it.
Thanks for having me.
Awesome. We'll have you again in the future for sure. And so, you really gave Ben a run for his money. I also want to definitely thank our podcast team. Angelique Davis is our podcast manager. Christian Brandt is our sound editor, and Jerry Katz writes our show notes. So definitely check them out. Remember to like and subscribe if you enjoyed this podcast, and listen to us again. All right, everybody, stay safe and stay dangerous.